This is going to be the femur fracture. This is for a mid-shaft femur fracture, right? So with a mid-shaft femur fracture, what we want to do is somebody's going to stabilize, okay? Once again, when they're stabilizing, hands above and below, we're going to expose. Once you expose, we're going to do a pulse motor, or we're doing an assessment, then we're going to do the pulse motor sensory, then it's for the treatment. When the treatment, we're going to use the KTD, the Kendrick traction device, okay? In this case, they call it the optimum traction device. It depends on the manufacturer. But with this, what we're going to do is we have an ankle hitch and we have an ischial strap. Because most everything we teach is distal to proximal, we're going to go ahead and put on the ankle hitch first. When you do the ankle hitch, quite literally, we're going to stabilize on this leg over here. Because remember, the stabilizer is opposite, right? So what we're going to do here is this goes underneath the ankle. Okay, you want to make sure that your green strap is let out all the way here. You want to make sure that your red strap is let out all the way here, because this is what we're going to use to cinch things up and tighten up the everything. Okay, so what we're going to have to do is slide this underneath. Remember, on this carpet it tends to catch just a little bit, but we're going to bring this underneath the ankle. This just comes up and wraps around. We need to make this nice and snug. From that point, we're going to take this, make sure this creates this little stirrup underneath here. We're going to take some of that slack out of that. Okay. And then we're going to leave that right there. Now we're going to move to the ischial strap. The ischial strap is the tricky one. Okay. What we have to do with this is the receiver tubes have to be on the lateral aspect. They have to be on the outer aspect of the thigh, right? So in doing that, we have to bring this underneath and click it up like so, and then take up the slack. When you take up the slack, if you get most of it out, when it comes to where we're going to tighten it up, the thing you need to be mindful of is this is a pull and feed maneuver. So we're going to pull here, and we're going to, pull here and push there. So pull and feed to make sure that's nice and snug. If it's too loose, what happens is it rides up. You lose your ability to do the traction. Okay. So what we're going to do here is we're going to take this. The tubes are going to be to the outside. We're going to feed this underneath the knee here. Okay, be mindful of where the fracture site is. And we're just going to slide this up here gently. Okay, make sure we don't have anything in the pockets. Make sure we're not catching anything here. We're going to put this together. And make sure, once again, that these tubes need to be on the lateral aspect, need to be on the outside over here, you know, at a reasonable height. Are we good there? We're not catching you up there, are we? No. All right. Once again, we want to pull and feed to get that slack. After the slack's out, we need to just rotate that around a little further. There we go. You want to get this to where you can get basically 2 fingers underneath, and that's where you want it, a little tighter. All right, there we go. Good. All right, now what we're going to do with this is we're going to take the tubes, the receiver tubes here, and you're going to just let the bungee right there work. What you have to have is this painted section, a black section of the pole down here with the foot. That has to be past the natural heel. Once again, shoes come off. If it's an injury during winter, let's say you got a ski boot on, they do make a boot strap. Okay, so you could use the boot strap. It's just that they're longer straps. In this case, we have the regular. So what we're going to do is we're going to lay this down, put the black section here, the painted section, past the natural heel. All right, that's the key with this. Then we're going to bring this up and see where the tubes meet. Now, in this case, they split right smack dab in the center of this. So this is where we're going to split the tubes, put these 2 in here. Okay, and bring this down here. Now, we are right on the cusp. We could potentially make this work. The other option here is to make it just a little longer. Remember, depending on how long you make this, you do have to consider the end of the ambulance. Okay, so you don't want to get too long. Like I said, we could potentially make this work even by taking this one out, like so. Because what you have here, this strap will take up to 2 full tubes. All right, so just for instructional purposes, so you can see things better, I'm going to leave it long. And what you have right here now is we're in the receiver tubes, we're in down here. We just kind of take a little slack out of it. There's no traction at this point. We're making sure that is where we want the device. Right now is when we make the decision to shorten it or lengthen it or make an adjustment. So if we're comfortable with this, we're going to go ahead and bring this up. Where's the kneecap? Right there. Okay. And we're going to secure this right directly over the kneecap. So your hand needs to be up just a little bit, securing that. There we go. We're going to bring this underneath the knee. This goes directly over the kneecap. Because what we have here is, once again, a mid-shaft femur fracture, And then we have a joint down here. So this is going to help secure things. So multiple facets. One, it secures the knee. Two, it helps hold the pulse and keep them from flexing. Now we're going to put ourselves down at the end. You have two ways to do this. Just like we did the ischial strap with the pull and feed maneuver, you can pull and feed, or you can simply place the foot in the palm of your hand, push and pull at the same time. You're going to go just until the patient gets what? A little bit of relief, right? So you're going to do that. Can you feel that?
Yeah.
Okay. So as you can see, we had a pretty good pull right there. Look at that. We only had like 2 inches. If we would have had this section up here, we could have still done it, but it would have been about, almost reached the end of what we needed to. We do have a little slack in this that we could take up to be able to finish that out, but in this case, it worked out better, I think, by having the 2 poles in length right here. And on the cot, like I said, you might have to have them shift up just a little bit. You got to pay attention to this. Don't be closing the door with this sticking out. Then from there, what we need to do is finish securing it. Think of the stoplight. We're going to start with the green, the yellow, and the red. So we're going to bring the green strap down here at the bottom. And remember, this does go over the pole. So I'm going to bring this through here. Actually, it's going to be easier to bring the tab through. There we go. Just because this is carpet, this tends to catch. All right, so just above the ankle here, we're going to take this. We're going to wrap that strap around like so. And then we're going to use the red one. The red strap goes either below or above, okay? The big thing we don't want to happen here is we don't want to be right smack dab on the injury site. So as long as there's enough here and this red strap is not going to end up on the injury site, we're okay. If it's going to end up on the injury site, don't use it. Okay, then we're going to finish with the pulse motor sensor. Can you wiggle your toes? Can you feel me touching your toes? And a cap refill, or we can come in and check the pulse. All right, then from there we're going to have them assisted up to the cot. All right, whether it's using a board, scoop stretcher, or a lift, or if the patient's okay with that, I've seen them actually use their own power and help.